All right.
Ladies and gentlemen, good morning. How's everybody doing? Well, you're a quiet crowd this morning. If you don't start talking to me, I'm going to hand the mic to John Britton. Yeah, that'll get them going. All right. John, we'd like to present a check to City Ministry Network. This is a result of the Carolina Chocolate Drops concert at the Gallo Center for $4,000 and some change. So... Thanks, Liz.
Lonnie, thanks. Do want to thank you for your help, helping out an organization that has no clue about fundraising, but learned an awful lot. I don't know how many of you were able to attend that concert, but yeah, it was. Yeah, if you missed it, you missed a great one. So, thanks so much, Lonnie. Appreciate all your help.
You're welcome. You're welcome. I wouldn't be Uncle Lonnie if I didn't engage in just a moment of shameless promotion. And so on the back table, you'll find two events that are being promoted. And the first one is the most incredible golf tournament in the Central Valley, Oktoberfest Golf at Del Rio Country Club. There's a brochure back there. Those golfers in the crowd, or anyone that has a husband that golfs, or if you golf, and just go get a brochure, check that out. It's very reasonably priced. It is a great event. And that benefits Hope Haven West, the wheelchair ministry that continues to provide. We're delivering 1,000 wheelchairs into 5 different countries between now and November 30th. And so, thank you. Uno más. Okay, the final one. This is country royalty, ladies and gentlemen. Marty Stewart at the State Theater. Marty was here last year with Roger McGuinn at the Gallo Center. We had a great concert with Marty. He's coming back. This is an event that benefits the Society for Disabilities. And so they've been working hard to bring this event together, and we've joined efforts with them. I am so excited to continue to work with you guys here, to see what's happening with City Ministry Network, to see what's happening with the collaboration in this community. Marvin, one of the things that just stuck with me from the very beginning was the idea that we needed to check our logos and our egos at the door. Let go of the fiefdoms and work together and communicate. And this is another opportunity to do that. Support a great organization in our community, Society for Disabilities, and also see a heck of a concert. There's posters back at the table. Pick one of these up, put it in your business. God bless you. Thanks much.
Thank you. Thank you. Welcome to our once-a-month gathering of Catalysts. It's a group of people that meet monthly that are leaders, that are influencers within our community. We care about our community. We come together to share information, to learn, to build relationships. So thank you. If this is your first time here, this is why we do what we do. I'm going to ask, we're going to say a real quick prayer so we can get started. We have a great speaker here today. So right there where you are, let's just bow our heads. Lord, we thank you for allowing us to get together one more time, to come together and to sense into what is it that you are doing in our community, and how, as believers, we can act on that, how we can show love, how we can show love to each other here, and how we can show love in our community as well. In Jesus' name, amen. Really quick, there is sign-in sheets at your table. Please take the time to sign in. It's very important to us. If you're new, put all the information. If you've been coming here, at least put your name. And that would be very helpful to us as well. I want to also just highlight. You also have on your table here a list of other networks that are getting together throughout our community. It's called the Modesto Networks. If you look at this half-page piece of paper, there are a variety of people that are getting together around particular interests and purposes. So please look at that list. If any of those are of interest, we encourage you to get involved in that as well. And there should be one thing that's really worked. We're going to test it again. There's if you look at this, it's think it's a few down. It's the Pastors Network, and they actually meet today. And I think they meet today around 12 o'clock. 11 o'clock, and where is it at Chevy's? If what we would like for you to do is take a few moments. This is the allowable time in this gathering here today where you can actually look at your phone and text. We would like for you to text your pastor and let them know that the meeting is happening this afternoon at Chevy's, and encourage him to go. Say this is a great network. There's other pastors. Tell them our Dr. Walker, our public health officer, will be there talking to them. So go ahead and do that now, and this is the only time we'll forgive you and not look at you cross-eyed if you're texting during the gathering. So it's 11:30 at Chevy's, and there's only one Chevy's in town. So we're real excited. We want to be highlighting young entrepreneurs in our community that are doing something different. And right now, we'd like to introduce Rochelle Van Hoon Cuadros. She's going to come talk about a business venture that she's undertaking. And let's give her a hand as she comes up.
Good morning. Marvin said I only have 2 to 3 minutes, so I don't really have time to go into my story and why entrepreneurship is a passion of mine. But I will be at the back and at the end, so I can tell you a little bit more about why I'm passionate about it. But beginning this year in January, I started a nonprofit called IDEAL, and it stands for Institute for Developing Entrepreneurs and Leaders. And the goal of that organization is to provide opportunities for, this year we're focusing on the youth in our community. We're offering 2 different classes to high schoolers. We're trying to stick with the junior to senior age range to teach them entrepreneurial skills, how to become a better leader, communication, marketing. They'll learn finance, a lot of the things that I don't remember learning in depth in high school and even in college. So it's an opportunity for them to take an extracurricular class. It's after school. It's something they have to choose to be a part of. No one's forcing them to be in it. But our vision for the future is to be able to offer it to the community as a whole, be able to offer it to, like with MJC or with the Sheriff's Department when felons get out of jail, helping them reintegrate into society. There's a lot of opportunities to offer entrepreneurship and leadership training. So that's what the organization's goal is for the future. But the curriculum we're using this year is through Fresno State, and so the students actually earn 3 units of college credit for taking the class, which is really awesome for juniors and seniors looking to start into college because they have a few units to start out with. But the curriculum is expensive, and so when I started this, I didn't think I would have any problem approaching local businesses and asking them to partner with us. And I still don't think I will have a problem. It's just I was pregnant and had a baby, so didn't have as much time as I thought I would to start fundraising. But we are looking for local businesses to partner with us, whether that be financially, offering internships to our students, just coming to class and being available for our students to ask questions, to hear their stories. We're just looking for businesses to share their experiences as well. So like I said, I'll be in the back at the end, and I don't want to take up any more time. So just come talk to me, and I'll share a little bit more.
Thank you. I'm going to ask the City Ministry Network Board. They're the board that sponsors this gathering here. If you, all the City Ministry Network Board members, if you could just stand up. I want to thank you all. This is a group of folks that, thank you. You may be seated. Just keep them in mind. They are, along with myself, I think I'm the newest board member to the City Ministry Network. And although I'm new to the board, I have been working with them for about over a year now. So I'm excited to be joining the board and joining this organization. And I think that's why I'm up here. I think because I'm the new person, they made me get up, and I didn't know any better. So, we're going to get to the most important part of the gathering here today, and that is you connecting with the other people at your table. So we're going to give you a few minutes to introduce yourself and who do you think you represent here today, whether it's your work or your faith community or your interest in your neighborhood. And we want you to discuss this question. What do you think are the 3 most critical health challenges in our community right now? What are the 3 most critical health challenges going on in our community right now? We're going to have Dr. Walker come up in a moment, but we want you to get connected on that topic. Make sure to do your best to be a good connector and have a good conversation. Thank you.
Well, good morning. Listen, we're going to do this. Let me just come over here to my friend over here, Pam Dumas. Stand up. Can you stand up, Pam? Because you're just so handsome. Yes, Pam. Tell us one thing that you learned about Alberta.
That she and John have been married for 49 years, and her daughter would trade orange peels for cupcakes.
Fantastic. Paid for a lot of counseling, didn't you, Alberta? Well, thank you so much for being here. Hope you got to meet people. Now, what we would like you to do, we do hope that you got to that second question about what you think are the three highest. Can you go me back, Randy? Go back one slide, would you please? There we go. What do you think are the top three health challenges in our community? Did you get to that question? Pardon me? That table's going to win. If you could grab your attendance form, because I know all of you signed in for us, right? And on the back of it, if one of you could write down the top three, okay? So I'm going to give you another minute to go back. What were the top three? Dr. Walker asked us, he got all excited because we're giving you a survey. And he wants the answers for that. And by the way, I don't think we've ever done this formally, but the interim city manager, Jim, can you stand? I know. Can we stand? Thank you. That's our city manager who's been here 3 weeks in a row. So anyway, the top three. You got those? Just leave them at the table, and then we will collect them in a little bit. So I'm sorry this was yours. We'll give you another minute. Dr. John Walker has been a dear friend of mine for quite some time since he got into town. He and his wife, Roberta, are caring for grandchildren and has just been a heart and an example of compassion in our community. He surely has set a model for myself and others when it comes to listening, really hearing, and working to collaborate and understanding, come to an understanding in our community. And he has modeled, at least for me, for sure, this generation's style of leadership, which is much more of a soccer match, rather than a football huddle. Now, I grew up in leadership where the quarterback got in the huddle and told everybody what to do. This generation is about a soccer match, and they're on the field together, playing together. And Dr. Walker has surely been a model and example for me how to do that. Our public health officer, Stanislaus County, would you please welcome John Walker?
Randy, oh, you turned it on. Whew. Okay. Well, good morning to all of you. I want to begin with some introductions because, as Marvin said, this is a team activity. But I met someone this morning for the first time, and I just need to honor her. So, Maureen, please stand up, because I was so impressed that she came this morning. She is an 89-year-old retired school nurse who still cares. You're special. And then I need to introduce my former boss, Bev Finley. Please stand. our new Associate Director for Public Health, Dr. Becky Nanyonjo. So, Becky came for the first time last month when Stan Rison spoke, and she and I were meeting last week, and she said, I was so blessed. She said, I have to come back for a refill. Then our new Director of Nursing, Debbie Jo Trinidad. Welcome. And then Randy, if you could put the first slide up. Oh. I'm not going to get much bigger up there. I'll never forget, back in high school, I was in the Glee Club, and the director said, can you stand up? And I said, I am standing up. Framework for a Thriving Stanislaus. And what is that? Well, it's a 10-year plan that started out, it was called the Community Health Improvement Plan. And in the depths of the Great Recession, our numbers were dwindling. And so we have a group called our executive group. And oh, I didn't know that. I'm on video. Hold it. Let me hold it. Sorry about that. I move around a lot. So the way the framework is set up is really a collaborative of stakeholders. One of our folks basically said, well, I can't justify being here because this is health and I'm not in the health business. And so we said it really needs to demonstrate by name a broader initiative. And so it was renamed the Framework for a Thriving Stanislaus. And I know that a number of you here have been active in our initiative, and I need for those who have been active to please stand up and introduce yourself and share the organization you're with. So please, if you've been active in the framework, can you please stand? Good. Okay. Good. Please introduce yourselves. Okay, please stand back up here. Stand back up here. Bev, you know I have to. Okay. Cleopathia Moore Bell is our hero. And it should be clear that she brought this to us. And no, I'm not going to tell how long you've been in county service. I understand that. But really, it is she is the consummate servant leader. And I talk a lot, and she really taught me to listen. So I'll give her credit for that. Thank you, Clete. Next slide. Randy, if we can go to the next slide. Okay. So those of you who know me know that this is my favorite slide. And Clee actually brought this to us in 2002 through a national initiative, and we got to be part of the beta testing, called the MAP process, Mobilizing for Action and Partnership Through Planning. And it redefined public health because the perception is that public health is there on Scenic Drive in front of the former hospital and across the street from the graveyard. But more importantly, a perception that public health was different from private health. But, you know, it's not about your insurance. It's a system. And there are many partners in the system. And there you are, right up top, the faith community, but also law enforcement, EMS, hospitals, healthcare providers, Reuben Behavioral Health, employers, economic development, mass transit, elected officials. Jenny, where are you? All right, enough said. Retired nurse, I would say. And philanthropists, but all work together as stakeholders. Next slide, please. This is taken from a presentation that we gave to the County Board of Supervisors last August. And the key message on this slide is alignment. So what it is there are a lot of initiatives in our community, and the intent of the framework is really to create alignment between national initiatives and local initiatives, and even within our community with our city and county leaders. One of the wonderful experiences that we had this spring was that the chair of the Board of Supervisors, in his State of the County address, spoke to the issue of healthy eating and active living. And we were greatly honored when our county became the first in all of California where all 9 incorporated cities had adopted a healthy eating, active living proclamation, and the board acknowledged that. Next slide. So this is really the important takeaway this morning about health and the framework, which is a slogan developed by the Robert Wood Johnson Foundation and adopted by the Centers for Disease Control. And it's really about looking at health in a manner that Sharon Hutchins, our lead epidemiologist, reminds us that we need to work upstream. And so this is about upstreamism. And the issue is that health begins where people work, live, learn, and play, and as the pastors will learn at lunch today, and pray. Get ready, pastors. I'm coming. Next slide. So we are currently in a 10-year initiative called Healthy People 2020, and the framework is aligned with Healthy People 2020. And so it has a broadened focus from care of sickness to look at broader causal factors and looks at broad determinants of health, including economic status and education. Next slide, please. So back in 2008, we did a community health assessment, and CLE convened our MAP stakeholder group, and our partners identified 4 key strategic initiatives to improve the health of our community. And that was access to health information and health care, education, basic needs, and the built environment. Now you look at all of those, and the question becomes, which of these would be most impactful in improving the health of our community? So anyone out there who hasn't heard me speak about this, give a guess. Which is the most important? Okay. Who said that? Stand up. Take a bow. Woohoo! Educational attainment is the best predictor of health outcomes. Okay? So I think this county is to be congratulated by the focus that a number of organizations have had on improving educational outcomes. Next slide, please. So this is the vision statement of the framework for a healthy Stanislaus and a thriving Stanislaus, which is healthy, educated, prosperous, vibrant, and sustainable. And so around here are some of the opportunities that we have as a county. Next, please. Now, this is a very important visual, and this was in a publication by Dr. Tom Frieden, who is the current director of the Centers for Disease Control. And what he's really identifying here is evidence-based components of health. And frankly, as a society, we kind of have this upside down, which is we tend to look at clinical interventions. But if you want to improve health, looking at socioeconomic and structural factors, and within that is education. And so what we have looked at are a number of important items. And so as a follow-through to Stan Rison's presentation last month, do you remember him saying the government is not the answer? Raise your hand if you heard him say that. Okay. So all of us working together are part of the answer. Next slide, please. Randy, the next slide. Okay, so I want to speak specifically about the targets that we have set. And we took this to the Board of Supervisors last August, and they approved it as our governing body. They're sort of our Board of Health. And so you need to know that these targets did not come from public health. John Sims, you're on our executive group, and you remember that this is really our stakeholders coming to us and identifying what some of these goals were. So these are our targets for 2020 for Stanislaus County. And so for third grade students as proficient, this is where we were in 2010. And this is our goal for 2020, which is a 41% increase. High school graduation rate, hugely important. This is where we are now. This is our goal for 2020. And you notice it may appear to be a modest increase, and those of you may have seen in our recent report, we have a reasonably good high school graduation rate, but we'd like to improve it. And then a very important initiative, which is decreasing our teen birth rate, and that's because teen pregnancy disrupts the educational process. Next, basic needs, which most of you in this room identified as a key initiative. And here, this is clearly a major initiative, which is dealing with the issue of food insecurity. And our goal by 2020 is to decrease that by 20%. And then children needing child care. John Sims here with our Children and Families Commission will remember that the Commission's first major strategic initiative, and that is The Children and Families Commission is funded for preschool children, pregnant women and their families. And when we started out, where's Bev Finley? Bev, yes, you remember this, okay? That our biggest focus was on child care. True? Yes. And so our goal is to increase that availability by 21%. And then obviously, residents living in poverty. Unfortunately, one of the greatest impacts of the Great Recession is the percentage of children in this county living in poverty. Sharon, what was the increase that we saw? 30% increase in children living in poverty in this county during the Great Recession. That's significant. So clearly, that's an issue that we'll need to focus on. And our goal by 2020 is a 20% decrease. Next, please. Then health targets, okay? Now, did you notice it was number 3? And it's number, you're saying, hold it, you're in health. How can you say health is number 3? Basically, we're saying we think that this will make, the 2 above it, will make a greater impact on improving the health of our county. But residents with health insurance, our goal is a 15% increase, and obviously with health reform, we're starting to get there. Primary care physicians, this is a great challenge for us. We have Dr. Payne. Dr. Payne, where are you? Our former residency director is here, and he knows how important it is to recruit physicians. And your residency has been successful in having 40% of your graduates stay here. So congratulations. That's a great record. And then providers per 1,000 resident, and our goal is a 12.5% increase. And then the last slide of targets, which is the built environment. And the reason there being that the environment does, in fact, have an impact on health. And this is, I know this may sound like a little oddity of walking to work, and you're saying, why is that so important? And that what that is really about is creating a walkable community. One of the significant issues, health issues in our county, is that we're built around the automobile. And the automobile does not promote active living. I'm a New Yorker, and I just got back from visiting my sisters in New York. And I'm from Brooklyn, New York. And I just in the past 2 years, the streets in Brooklyn, all of the major thoroughfares now have wide bicycle lanes. And so one of the things that is going to be extremely important is creating active transportation and a format where it's more walkable. And then one of the phenomenal ironies of our county is that we're producing fruit and vegetables for the nation, but in fact, we have food deserts, healthy food deserts within our county. And clearly, our goal by 2020 is to have a 44% decrease. Next slide. This is just a slide from our MAP Stakeholders program last April, which is the format in which we get input. Like this morning, the input we're getting from you. And actually, Marvin, where are you? Right here. Okay, you were on our panel speakers, if you remember, last April. So thank you again. Next slide. Just want to promote a report that we frankly published 2 weeks ago. 2 weeks ago. There's a copy of the summary on each of the tables. Sharon, can you hold it up so folks can see what it is? One of the things that we're most excited about is the back cover. Turn it over and look at the back cover. And what we're most excited about is the partners who participated in the process of putting that assessment together. Please be aware that it's available online, this report that you see in front of you, which is a summary, for those of you who need all of the data. The full report is online as listed here. And if you need more specifics, Sharon, raise your hand again. You can see her afterward. Whoever was the first person to arrive at the table is entitled to take it with you. First come, first served, okay? But oh, you brought a few extra? Okay, so see Sharon. Last slide. Questions and answers. I'm very open to any questions. How am I doing for time, Marvin? Do I have time to answer? Okay. Any questions? Is there a mic that, is there a mic that we could?
Yeah, Doctor,
Tell me your name, organization.
Kevin Carroll with Modesto Gospel Mission.
Yes, sir.
Serving the homeless in the community, and statistically over the last 10 years, the trends that you guys have seen, what are some of the areas that we can focus on as a community to help get involved in these initiatives with trying to prevent a faster slide, particularly among the children? Because we've been servicing more women and children. That seems to be the largest growing population of homeless right now. Any strategies that you have from a public health sector?
You know, I really have to go back to a conference that Stan Ryson was one of the keynote speakers. And that conference was called Strengthening Families. And even within the faith community, a number of you remember a few years back, Brad Hahn got together a group to try to identify what was the major issue in our community. And one of the major issues one of the major health issues in Stanislaus County is the family and the integrity of the family. So that being so, a fair amount of homelessness is related to single parent families, okay? And especially the statistic that Stan presented last month, which is the impact of a fatherless home. Now, clearly, Reuben, wherever you are, we know that drug abuse is clearly one of the issues. We know that incarceration is one of the issues. Chaplain, you know that well. So I would say that if we want to work upstream, okay, it's about really focusing on and strengthening the family. And my goodness, the faith community can be the lead. Any other questions?
I just wanted to ask, I love the idea.
Name, organization?
Debbie Without Permission.
Without
permission?
Okay.
I know, I love that blank look. We'll talk next later.
Okay.
It's okay. In regards to making this a mobile community by walking and healthier, I love that. I'm going to champion that. Is the walking path out where the railroad tracks used to be, as well as these wide green bike paths, is that a result of this initiative? Is that something that we're seeing turn around, and it's a great great effort. I just was wondering if the two are connected to your initiative and what we're seeing happening in the community.
The answer is yes and no. We would love to take credit for all of it, but we can't. However, our built environment work group within the framework has representatives from both city and county planning commissions. And so yes, they have been part of this process, and yes, they have been working with us since 2009. However, for instance, that the bike path, the Virginia Corridor bike path, is really a public-private partnership because some of our service organizations help to fund that. So again, it's public-private partnerships. But clearly, public policy is very important in that regard. Any other questions? Yes, Maureen.
Are well baby clinics in various parts of the town passe, or have they thought of having them? Sometimes transportation is a problem, especially if you have quite a few little children in your family.
Maureen, that's a great question, especially with your experience in Alaska, where transportation was an issue. And I will share for those of you who are in leadership positions that our transportation system is one of our greatest health needs. Because if you have a mom who lives in Oakdale, the only way for her to get to the provider, or if she's going to get out to CSA, is to come all the way into town and then go all the way out to Crow's Landing Road. And she has to think about the kid who's in school with childcare. So the point is that our transportation system and improvements within that will be a very important component. Where we have been working the hardest, and Clee focused on this, and I know for Debbie Jo, this is a major need, which is when you speak about well baby checks, one of our big challenges is being sure that mom gets to her appointments. And so one of our focuses has been on healthy birth outcomes. And one of the challenges that we face in prenatal and postnatal care is access to clinics. So, to make a short story long, I will share with you that one of the things that Bev Finley did back when our county hospital closed in 1997 is that she had a strategic plan to take what were our well baby clinics that were public health clinics and make them primary care clinics, okay? And so now we have a series of clinics around town that are broad primary care clinics. So the answer is we're getting there, but we need to go farther. So thank you for your question. Chaplain, I think this is probably going to need to be the last question.
I just wanted to ask you, how have you given consideration to amassing volunteers to work with individuals in the area of transportation and just assistance? Have you given that any kind of thought or actions in gaining volunteers?
Chaplain, I'm going to ask Sharon Hutchins if you can bring the mic back up. She's been coordinating our built environment group. Sharon, can you stand up and respond, please?
I love that idea. I spent some time in Costa Rica where there were microbuses, little buses, little vans that took people around, and that was very convenient. We have actually talked about this a little bit. Some of our FRCs have worked with churches on the west side.
Tell them what FRCs are.
Oh, sorry, Family Resource Centers. But I think we could really stand to have this be a much bigger initiative. I think that's a really great idea.
Please give Dr. Walker a hand. I was sitting over here, kneeling over here next to my friend Ross Briles, and Clee and Ross worked together, right, Clee, on the neighborhood trail, the lateral park there between, California and Mays Boulevard, and it was an incredible partnership with all of you. So I know there were some others. Hugo, I think were you a part of that as well? So kind of? Okay, kind of. So thank you so much for all of you. You keep hearing the same message, and I do too. I won't be long. Rowing together. Rowing together. And there's so many other topics, so many needs are out in the community, so many challenges. I want to encourage you. We all can't do everything, and you can't do everything. And quite some time ago, I had to release myself from the emotional burden to jump on every train and jump on every burden, to do that. And so I want to encourage you all to have some, I'll just tell you how I'll say it, just emotional freedom to pick and choose where your battlefield is. And for me, it's my spiritual call. Where is God calling me to invest my time and energy, my best focus? My wife would be different. She has some other interests, and that's where she runs. We do some things together, but for the most part, I want to encourage you on that. The big idea, though, is rowing together. And last month with our presenter and this month with Dr. Walker, all of us in this community figure out how to row together. Let's do that. We have a history in our city of not doing this very well, and we're getting better at it. And so if anything, keep short accounts with each other, talk to each other, have coffee together, get to know each other, and then over time, some of those differences and misunderstandings get to come apart. So rowing together. Just a couple of things, then I want to read a poem to you. Do I look like I'm a poem guy? Sure, I'm just real sensitive. Next month, and I do know what Without Permission is. Debbie Johnson is a director of Without Permission that cares for and advocates for sex trafficking victims all up and down our region. And Debbie is quite a passionate advocate for those young women as well as men. And she'll be with us next month. So you'll get to hear her. She's terrific. And her office is just down below, underneath mine. And she's just an incredible woman of God and incredible integrity. So I respect her deeply. The other things, a couple of different things too, as well as next month, Public Servants Breakfast. We'll be meeting here with Debbie. And then the week after that, Christian Public Servants Breakfast at Big Valley Church. And our own Cindy Marks will be the chief presenter. There was Cindy. What? Debbie's in November. How about if I just turn around and mind my own business? October. That date is wrong. Will you be here on October 2nd? All right. Okay, I'm Baptist. Put that arm down. You're not supposed to. Wait, we can't do that here. Sorry. Oh, that's old business. So I'm glad you all laughed at that. I'm glad. Put that down. We're not supposed to. Okay, October 2nd. Right? Okay, yeah, I'm a professional. We got these slides right. October's my fault. October 2nd, Catalyst, fighting against human trafficking and what? How about if I'm wasting all your time here? October 2nd, Jill Stearns, higher education in Modesto. How's that? Thank you. Debbie was willing to take both months. Know that. And then November 6th, fighting human trafficking and succeeding. How's that? Okay. Thanks. I'm glad you're all laughing at me or with me or whatever this would be. Yeah, I love you too, man. You've all been here. And then the week after that, after October, is, yes, I won't even try. Just go to the Christian Public Servants announce. Thanks for laughing. You're going to roll your eyes. I'm never coming back. God doesn't do announcements, right? New problems. Looking at new ways at old problems. A few years back, as I was struggling through trying to rebirth myself, my ministry, looking at old things and old challenges and the same old things in a whole different way. I was going through some real insecure times. You know, when you try to break out of the box and you try to do some different things, you have critics and you have commenters. And again, when I was younger, I was real sensitive about that. And oh my gosh, I'm doing it differently. That means I'm a failure, I'm a loser. You know, that whole thing that goes on. Anybody relate to that? There was an Apple commercial, I saw it somewhere, and it just really encouraged me. And I want to read it to you as well. It's called To the Crazy Ones. And I think of Eric Young with his new app, and when it comes to Rochelle and so many others of you who are trying to look at these old issues, these old challenges, these old problems in a whole different way. And I want to encourage you, and if you feel this way, I want you to know that we are in a season, and I'm hoping this will be a pattern for us as we develop culture in our community, of looking at old challenges in new, fresh ways. And I saw this to the crazy ones, because I did have people say to me, "You're crazy." I was crazy. And it was disheartening because I'd never seen other models before. And now I get to hang around with a whole bunch of you that are crazy. And so this is an encouragement to you, to the crazy ones. Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in square holes. The ones who see things differently. They're not fond of rules, and they have no respect for the status quo. You can praise them, disagree with them, quote them, disbelieve them, glorify them, and vilify them. About the only thing you can't do is ignore them. Because they change things. They invent, they imagine, they heal, they explore, they create, they inspire, they push the human race forward. Maybe they have to be crazy. How else can you stare at an empty canvas and see a work of art? Or sit in silence and hear a song that's never been written, or gaze at a red planet and see a laboratory on wheels. While some see them as the crazy ones, we see genius. And it's the people who are crazy enough to think they can change the world or change the city who actually do. Here's to the crazy ones. You are the true dreamers. You are the true dreamers. Master, thank you for these men and women, for what you're doing in them and through them. May they be declared and accused of being crazy, In Jesus' name, amen. Bless you all. See you next month, Lord willing. See you around the streets.